Hi, my name is Professor Frank Chinegwundoh MBE. I'm a consultant urological surgeon based in London. Today, I'd like to talk about prostate cancer. So, prostate cancer is the most common cancer in men in the UK. We're talking about some 52,000 new diagnoses every year. There are certain things that put you at greater risk of developing prostate cancer, such as it increases with age. You're 2.5 times more likely to develop prostate cancer if you're black, and you're more likely to develop prostate cancer if there is a family history. So, for example, your brother or your father or an uncle has got prostate cancer. So what is cancer? Well, cancer is when the building blocks of the particular organ, in this case the prostate, grows in an uncontrolled manner. And when these cancer cells spread outside the prostate and go to other areas of the body, they can end up depressing the function of that body, which leads to the man's demise. The good news about prostate cancer, however, is that if it's found early, the cure rate is extremely high. If it's diagnosed when it's already spread, there are a lot of very good treatments that can keep the man alive and well for several years, but they're not able to actually get rid of the prostate cancer. So in terms of presentation, in terms of diagnosis, nowadays, I would see many men who have had the PSA blood test, the prostate-specific antigen blood test. This is a simple blood test that can give an indication, if the blood level is raised, as to whether the man may have prostate cancer. Other things can raise the PSA, such as a very much enlarged prostate gland, prostate inflammation, prostate infection, and so on. But certainly, if I see a man with a raised PSA that is over 3, then we would start the investigations to determine whether the man has prostate cancer. I think it's important to say that you may have no urinary symptoms or no sexual symptoms whatsoever, but still have prostate cancer. Hence the value of having a routine PSA blood test. Having said that, there are certain symptoms that can indicate that you may have a problem with your prostate gland, such as difficulty in starting your urinary stream, a slow stream, it may dribble at the end, you may feel like you've not emptied your bladder completely, you may find yourself going more often than you're accustomed to passing urine. Also, you may have to get there in a hurry, or at times you can't reach the toilet in time and it starts to leak out. Or you may be having to get up at night to pass your urine. So these are the signs and symptoms that you may have a problem with your prostate and you may have prostate cancer. Now, it's important to appreciate that most men with those kind of symptoms will just have the ordinary enlargement of the prostate. The problem is you can't tell from the symptoms alone whether it's the ordinary common enlargement that most men will experience over the age of 50 or whether those symptoms are due to prostate cancer. Also, if you develop erectile dysfunction or you find yourself perhaps passing blood in your urine or blood in the seminal fluid, then these require investigation in case they are due to prostate cancer. So what are the tests we do when we see a man either with a raised PSA or urinary or sexual symptoms? Well, after a careful examination, we send the man for an MRI scan. And that MRI scan is quite a detailed examination of the prostate. And if it shows up areas that look abnormal, then the next step after that is what we call a biopsy, where we put a needle into the prostate and we take samples to be analyzed. Now, if the results come back as showing prostate cancer, then depending on the grade or how aggressive the cancer cells look under the microscope, there are various treatments that we can offer those men. So ranging from radical surgery to remove the prostate gland in its entirety, which is an abdominal operation, or radiation, which can be external beam radiation, or it can be brachytherapy, which is where we implant radioactive pellets into the prostate gland. There are other treatments such as focal therapy, which is where you just destroy the area of the prostate where the cancer is, assuming it's not widespread throughout the prostate gland. Also, we have this concept of active surveillance. So some men in which we diagnose prostate cancer, there's only a small amount and the cancer cells don't look particularly aggressive, the PSA is relatively low. Those men we can just monitor without treating them radically. We can monitor them by means of the PSA blood test. We can monitor them by repeating the MRI scan. And if things stay stable, then there's no need for the man to undergo the more aggressive treatments, such as surgery or radiation and so on. And the reason why active surveillance is good is because many of the treatments that we have for prostate cancer, although they are very good indeed, and I've mentioned before, the cure rate is very high, nonetheless, there are side effects to some of the radical treatments for prostate cancer. So not all prostate cancers need aggressive treatment. And the thing about finding it early is that if it's found early, then the treatments are effective and the man can be cured of that disease. Now, unfortunately, at present in the UK, we do not have a national prostate cancer screening program. We have screening for breast cancer, cervical cancer, colorectal cancer, but as things stand, we do not have a screening program for prostate cancer. Therefore, it's up to a man to be aware of the prostate gland and to take themselves off to their GP to get a PSA blood test. There is also what's called a prostate cancer risk checker. This is an online form on the Prostate Cancer UK website, which you fill in certain things like your ethnicity, your age, your family history, and it'll give you your percentage risk in terms of prostate cancer. And if your risk is higher than normal, then it would advise for you to see your GP with a view to having your PSA and onwards referral to a specialist urologist.